Hello, how are you everyone? I hope you are doing fine. This is Dr. Courage, and I'm going to take you guys in first aid treatment or management course. So this course, it mostly deals with first aid management or treatment. If someone has been injured, the first aiders are the first people that they in line to make sure that the casualty is fine before start receiving any treatment. For instance, if someone has been injured, the first aid, they're supposed to be there to check how big the wound is or the injury is. If the person is breathing, if the patient is breathing or severe bleeding, that is hemorrhage, so the first aid, they're supposed to be there to stop bleeding by putting them the bandage. By doing so, you prevent from the loss of a lot of blood, that is severe hemorrhage. And again, for someone, maybe I may say those that they do athletics at school, we have people that we call health prefects. So those health prefects at school, the most job that they do is during the athletics or any activities at school, someone has just collapsed or go unconscious. They know that this person has run out of air. It means the air is very insufficient. So they get that person who has collapsed, they check, they do a screening whereby they do the physical examination to check if maybe there's dislocation of bones. They make sure that they put the bones in place, or maybe when he was falling, he or she was falling down on the ground, they check if there is any injury that is bleeding in order to stop the bleeding, or if there is insufficient air, they make sure that they provide the artificial air to make sure that the casualty regain the consciousness as soon as possible. So these are the first aiders that they in line to make sure that the person who has been injured or who is ill is well protected before starting receiving many treatment or before reach to the hospital. That's what it means. So whoever helps someone who has been injured or ill before reaching to the hospital, they considered as first aiders. So if you help anyone before reaching to the hospital as an emergency, then you will be considered as an first aider. So I guess that's what I can say at the moment. Not to waste much time, by the way, this is a Supreme Institute of Applied Sciences and Technology, and this is Dr. Courage who will be taking you in this course. So not to waste much time, let's proceed to this lesson. This is the introduction of this course. So let's proceed. So here, this is the introduction of the same course. It's an introduction. Here, it's an introduction. So a person who gives treatment for the one suffering from a disease or an incident to improve his condition is called an aid, like I've said, and the medical treatment given as aid is called first aid. You see, so what they're trying to explain here is that the first person who gives treatment for the one suffering, they called AIDS. So aider is a person, and the first treatment is called the first aider. So this one is a person who has helped someone who has been injured or ill from a certain disease. So this one is a helper, and here is the treatment. So first aid is a treatment. Then aids, these are people that has helped someone who is sick or injured. That's what this statement is trying to explain. Let's go on point number 2 from here. So if an accident happens in the workplace, you cannot be a helpless witness, since simply standing by can potentially worsen the situation. This is why it's important to have at least a basic knowledge of first aid. Exactly. So if someone has been injured or someone has been sick or ill suddenly and you are there, instead of just being there watching and shouting, you can do something to help that person, so that as the medical personnel or an ambulance upon arrive, you are supposed to do something. For instance, if someone has collapsed and you know that this person, the way he has lying down, cannot breathe properly, you can put that person in a normal position. If he has lie down on a prone position, prone position is where the face has a face down. So you can change for someone to breathe properly, to put that patient or casualty in supine position. Supine position is where the patient has lied down, the face up. Meaning by doing so, the patient will breathe properly. Because if the face has faces the ground, it will be very difficult for a casualty to breathe properly. So by doing so, it's one of the first aid. If you know that where the casualty is, there is insufficient air, the air is not passing enough, you can either get that person out from the room and put that person at the open place in order to create artificial oxygen. By doing so, it's part of a first aid as treatment. Let's proceed. So here, at its most basic, first aid is the initial assistance given to a victim of injury or illness. At its most basic, first aid is the initial assistance given to a victim of injury or illness, comprised or relatively simple techniques that can be performed with rudimentary equipment. First aid is usually carried out by a layperson until professional medical assistance arrives. Yes, so here, first aiders can be anyone who have just a little knowledge about how someone can survive as they are waiting for the professional medical personnel to take over. So if you are there, for instance, someone has emergence of a stroke, instead of just waiting the person to die there as you call for an ambulance to come, or as you are waiting for a transport to take that patient or casualty to the hospital, you can put that person who has a stroke in at least good position where the blood will be passing normally as well as breathing normally. So by doing so, you'll be considered as first aider or initial assistance. So make sure that at least you have a little knowledge on how you can help someone during the emergencies. You can be in the bus, then you have an accident, or maybe you are just passing outside the road, then you see the accident. You're supposed to rush there, at least to make sure that those that are still alive, you put them at least in good position for them to breathe properly, and those that are severe breathing, at least you stop the breathing there, and then you can look for some other means. Maybe it's near the I don't know, it can be near a nurse if where you are, the place, there's no way you can get the cloth, at least to tie the wound, to stop the bleeding. Those that they have made dislocations of bones, to put them in normal position. You can at least try to do something. By doing so, you'll be considered as first aider, meaning you didn't just watch, but you were there to help. Hope we are clear on the introduction. Let's proceed. So here is the definition of first aid. So definition says, First aid is the provision of immediate care to a victim with an injury or illness, usually affected by a layperson and performed within a limited skill range. This is the definition. I'll repeat it. First aid is the provision of immediate care to a victim with an injury or illness, usually affected by layperson and performed within a limited skill range. So that's the definition. It's straightforward, I think. No need to explain, because some of things I've already explained from the previous slide. So let's move. So first aid is normally performed until the injury or illness is satisfactorily dealt with, such as in the case of small cuts, minor bruises, and blisters, or until the next level of care, such as a paramedic or doctor arrives. So these are things that you can do in a case whereby small cuts, at least you're supposed to clean the wound or stop the bleeding, or just minor bruises. These are just bruises whereby someone maybe has hit himself or herself maybe to the door or to anything, then have those bruises or blisters. I think you know all these things. If you want to know more so that you can stick into your head, when you hear such kind of words like minor bruises, though it's just straightforward English, blister or small cuts, just search them. Types of small cuts, types of minor bruises, just search them, then they will give you the definition as well as the pictures. By having the pictures, it means it is very hard for someone to forget something that is in the form of a picture. Yes, so or until the next level of care, such as paramedic or doctor alive. So I think this one is all straightforward now. No need to elaborate more. So let's go to the third point. First aid is an emergency aid or treatment given to someone injured. First aid is an emergency aid or treatment given to someone injured, suddenly ill, etc., before regular medical services arrive or can be reached. So this is the first treatment that you give to someone who has been injured or ill before the main treatment that has been provided by the professional health personnel, or before they arrive. That's the first treatment you can give. Let's proceed. So objectives of first aid or guiding principle. Here, that's where we are. Objectives of first aid or guiding principle. So the key guiding principles and the purpose of first aid. The key guiding principles and purpose of first aid. So number one, the key guiding principles or purpose of first aid is number one, we have what we call prevent further injuries. The casualty has injury, can be road accident, it can be by fire, home, or it can be just a sudden illness. So number one, you prevent further injuries. Number two, you preserve life. You know, as a health personnel, we always preserve life. Number three, promote recovery. Then number four, to help to ensure safe transportation to the nearest healthcare facility. So as you can see here, it's just a picture where it's showing Someone have you seen? So this is the sudden illness. So maybe this person is having the headache or dizziness, something like that, then has collapsed. So have you seen what it's doing here? This one is doing the cardiac arrest. This one we call cardiac arrest here. First, this person was feeling dizzy. Picture, as you can see, is feeling dizzy, touching the head, feeling dizzy. So all of a sudden, this person has collapsed, and you are there or you are not there. Then just hear people shouting, "Hey, someone has collapsed! Someone has collapsed! Come, you see, come, you help!" So if you're there and you have a little bit knowledge on how you can get someone to a consciousness, you start doing the cardiac arrest. So this one is a cardiac pulmonary resuscitation. That is CPR, cardiac pulmonary resuscitation. That's what this person is doing on the chest there, chest compression. So we call it a CPR, cardiac pulmonary resuscitation. Don't worry, these are big terms, most especially for those that are doing registered nursing, clinic officers and doctors, but you should just have familiar with these terms. You can search what this word means. CPR in medical terms, cardiopulmonary resuscitation. You do it most of the times when someone is unconscious or maybe has drawn into the river. Then you manage to retrieve that person, and you feel the body is still warm, and you can tell that this person is still alive. You can do that cardiac pulmonary resuscitation. I'm sure I need to send some of the videos how they do it. So under this cardiac pulmonary resuscitation, most of the first aid, what you do, you check on the what we call triaging. There's triaging and priorities. So under triaging, you check what is A, B, and C. So these, let me rub the screen, it's too dirty. So A stand for air. A stand for air. Then under air, you check if the person is breathing. You felt from the nose, if from the nose or mouth. If you feel the warm air or cold air, you tell that okay, this person is breathing, is still alive. A. Then B. B stand for breathing. You can check either on the chest, you can check on the pulse. You check the pulse rate if the person is breathing normally. Then circulation. You check if the person is conscious, has gained the conscious, or is unconscious, or if the airway is circulating normally in the body. It's called circulation. Yeah, so I don't want to confuse you to go deep in these things, but as we go further, I think you have at least a little bit knowledge on what I'm talking about when I talk about the triaging and priorities. So triaging, it means the first thing that you can do. If you have two options, you can have priorities and triaging. For instance, someone who is severe bleeding, you know what you mean severe, is losing blood in a manner that within some 30 seconds someone might die. And there's also another casualty here who has lain down because of just a headache. So where can you go first? To someone who is losing a lot of blood at a very fast rate, or someone who is just sick with a minor headache? Where can you go first to save life? To my opinion, or to my point of view, I would rather go and help someone who is in severe bleeding, because severe bleeding will lead to hemorrhage, and hemorrhage, it's lead to hypovolemic shock. If someone has lost a lot of blood, it will end up dying. People that they lose a lot of blood within a short period of time, they die fast. So for this one who is just having a minor headache is just sometimes minor headache, it means just a a primary headache, not even a secondary. It can heal on its own. Maybe just take a lot of water. So for this one, can wait. First, you deal with this patient who is losing a lot of blood. That's what triaging means. Then priorities. Priorities, for instance, you can have people on the queue who have come to the hospital. So on the priorities, you check according to the vitals, which one do you think is supposed to be attended first? You check on the children, they have maybe you check the temperature, it is 39.2 degrees Celsius, and someone is maybe 35 or 37.2. Which one can you go first? Let me clean the screen. Someone is 39.5 degrees Celsius, and another one is 6.7 degrees Celsius. So which one among these two supposed to go and the registration or to be attended first? It's the first person because the temperature is high. So this one shows that is very sick compared to this one. So that's what priorities means. I hope my explanation is well articulated and you have understood. Let's proceed, not to waste much time. So here is philosophy of first aid. Philosophy of first aid. So in the pre-hospital setting, the key contributors to survival and recovery from illness and injury are prompt and effective maintenance of the body's primary function. So, have you seen what I was talking about? Airway, breathing, circulation. It has come here. Meaning I've already explained this, no need to explain more. So, airway, you check if the person is breathing, you can feel the air. If it is coming out either warm or cold, you'll be able to tell that the person is still alive. Then on the breathing, you can check on the pulse, either on the chest or it can anywhere else where you see that you can find a pulse. I will give you a picture, most locations where you can find the pulse to know that the person is breathing. Then on circulation, I've already explained about these things. Yeah, so make sure you have this knowledge. They fall under triaging. That is ABC, airway, breathing, circulation. Then we can proceed. Breathing control, life threatening. So most times when maybe there is an accident, breathing is what kills people most of the times, most especially when the first aiders or maybe an ambulance has take a lot of time to arrive and the person is losing a lot of blood and there's no one to help, to aid or to first aid that casualty, will end up dying even before an ambulance. So make sure you always protect people who are breathing. When there's an emergency, you stop that breathing, you put the bandage. If you cannot have a bandage, you can ask anything that you can tie it to prevent that blood from passing to that other side. You just tie it, not that hard, whereby the blood is stopped completely, but you at least cover that wound or injury so that the blood can stop coming out. Can be coming maybe, but not that much. If maybe that person have an object, don't remove it. Someone has a cut in the head or in the stomach, then there's an object or a bottle, or it can be anything that is in that stomach or head. Don't remove it. Let it be, but make sure you try to prevent loss of blood, because when you remove that, you don't know where that cut, that deep it has gone, the object, so you end up worsening the condition. Wait for the people that have been trained for that. Let's proceed. The first, what am I talking about? Importance of first aid. Importance of first aid. So the importance of first aid is hard to overestimate. Among the major benefits of first aid are the following. Number one, providing quick medical treatment until professional assistance alive, providing quick medical treatment until professional assistance alive. So you provide the first treatment before the professional assistance alive. Then number 2, the importance of first aid is first aid helps ensure that the right method of administering medical assistance are provided. The right, to ensure that the right method of administering medical assistance are provided. Yes. Then number 1, that is number 3 now. Knowledge in first aid also benefits the individuals themselves. Knowledge in first aid also benefits the individuals themselves. That is true. There another importance of first aid. It affords people with the ability to provide help during various emergency situations. Okay, let's proceed. Don't worry, this is just the explanation. I think if you don't have these notes, I'll surely forward these notes to your groups so that you can read them and write at your own free time. Let's proceed. Principles of emergency care. Principles of emergency care. So correct the detailed here. This is the subtopic. So correct the detailed history of accident, either from the victim or from anyone who has witnessed the accident. So correct the details history. So first you correct the history, the detailed history of the accident, either from the victim if it is conscious or from anyone who has witnessed it. So they will tell you what exactly has happened so that you know where you can start from. You cannot just go there and start doing whatever you can do, but first you ask so that you know what has really happened. Then number 2, you're here, then you're here now. So the victim's injury should be examined thoroughly, taking note of every symptom to know the correct diagnosis. Exactly. So you're supposed to examine the injury, how deep it is, taking note of every symptoms. You know, you should know about signs and symptoms. So symptoms is something that a patient is having. For instance, you can notice from the breathing, you can notice maybe from the cut, all those things. So don't worry, I'll talk about the signs and symptoms so that you can understand them better. Then point number 3, by the help of the diagnosis. Diagnosis is to find the problem, the cause, like what the mechanics do. When they find a fault to a truck, to a car, to any vehicle, that is same as diagnosis. So diagnosis is to find the problem. So under diagnosis, you diagnose, you find the fault as well as the solution. That's what in mechanics do. When they find the fault, they also provide the solution. So here you diagnose, you find the fault, again you also find the treatment or the management. That's what the diagnosis is. So there is diagnosis and the prognosis. Diagnosis is to find the problem as well as the treatment. Then prognosis is the one that we call review, to check if they treat maybe the casualty or the condition is adhering the drugs, or if there is an improvement in the healing process. That's what the prognosis means. There is prognosis and diagnosis. Try to search these terms so that you become familiar with these things, so that as you go to the hospital doing the attachment, at least you have some knowledge to where you can start from. Yes, so let's proceed. Call the doctors or shift the victim to the hospital as soon as possible, so that the patients can recover soon from doctor's treatment instead of prolonging the first aid. So you do it quickly. You call the doctor or an ambulance, or take that patient, you provide the transport, your help. Even if you don't have money, whatever you are doing, you're not doing it for people to vote for you or to stand as an MP. You are doing it for just your passion and love, and by doing so, God is the one that is going to reward you. Even if the government has not recognized you for what you have done, or the people in the community have not recognized you for what you have done, but by doing so, you are doing the good things, and God is going to reward you for your deeds. So always work with passion, work with love. No wonder in the medical field, it's passion. It doesn't matter the salary you are getting. It doesn't matter how appreciate or you're being appreciated or de-appreciated, but always work with passion. Don't just work for the sake of working, then you're going to hate the job. Let's proceed. Here, let me do this. Should be the okay, golden laws of first aid. So these are the golden laws of first aid. So here we have the golden laws. Number 1, we have do first things first, quick, quietly, and without fuss or panic. That is first golden law. Do first things first, quickly, quietly, and without fuss or panicking. So you do it, the thing you're supposed to do first, you do it in a quickly, quietly, and without panic or fuss. Then golden law number 2, give artificial respiration. The one I was talking about, someone has just collapsed, you give artificial respiration or oxygen to help someone breathing. Give artificial respiration if breathing has stopped. Every second counts. That is good in number 2. Then number 3 here, stop any breathing, what we have been explaining over and over. Then number 4 here, guard against or treat for shock by moving the casualty as little as possible and handling him gently. Okay, then number, that's 1 2 3 1 2 3 4. Then number 5, do not attempt too much. Here, do not attempt too much. Do the minimum that is essential to save life and prevent the condition from worsening. Okay, then reassure the casualty and those around, and so help to lessen anxiety. You know, anxiety, that is feeling like fear. It's more like fear. Someone who is not oneself is scared, is in panicking. That's what anxiety means. Yeah, so let's proceed with point number 1 2 3 4 5 6, should be 7. Do not allow people to cross lawns as fresh as is essential. Okay, so do not allow people to cross lawns as fresh air is essential. So what do they mean here? If there's someone has just collapsed or there was an accident, make sure that that person is not surrounded by a lot of people or crowd. By doing so, it means that person is going to have a sufficient oxygen, and you're going to worsen the condition of the casualty, may die because of the lack of oxygen. So if you tell people that this person at the moment need a lot of oxygen, so by covering this casualty, we may contribute the worsening of the condition, because this person at the moment is having difficulties in breathing. So let's create a space. If you want to watch, can you watch it from far, what I'm doing or what is happening to this person, not until the health personnel or the doctors or the ambulance arrive. So by doing so, you help that person to have enough oxygen. Are we together? Yes. So make sure you do that. Not just no, people, they start shouting, why are you telling us to move out? Why are you telling us to do this and that? You explain to the people that are there so that you can make them understand. Because if you are not explaining to them, they may think maybe you want to search that person, you get the money, or you want to kill that person. So you explain on what is really happening to that person, since you are there to help. And to those that they don't know, you make them understand. So we are here where it says, do not remove clothes unnecessarily. So we don't remove clothes unnecessarily unless it is the casualty is already at the hospital. That's when you can do that. And mostly the doctors or the nurses or any health personnel can advise how to do it. Okay, so we are coding number 1, 2, 3, 4, 5, 6, 7, 8, number 9, if I'm not mistaken. Arrange for the removal of the casualty to the care of a doctor or hospital as soon as possible. Okay, let's move. We are talking about the golden laws of first aid. So we can move. So here, these are the things. Let me see. My screen is half because of there are a lot of information at my screen, so I don't see a lot of information unless when I do this. Sorry. So content of the first aid. So first aid kit. So here is the kit of the first aid, things that you found inside, that you find inside. So you have what we call geyser, law, and pads here. Geyser number 1, they can be pointing, so here it can be number 1, geyser, law, and pads. So we have here what we call bandages, then we have adhesive tape, then we have first aid manual, then we have here I can't see properly what's this, emergency contact information. So here is the emergency contact information. The medical can be a doctor or any number that you can use here in contact information for family or what, yeah, information for family members here. Yeah, sorry, my screen it has a lot of information, so I'm unable to see clearly. Then we have tweezers here. This is the tweezers, and here this is the scissors. This is a triangular bandage. Then we have antiseptic wipes, emergency blanket, elastic bandage, all those things, instant cold pack. Then you have a thermometer checking for a temperature. Yes, so find time to study these things and master them. Make sure you know them and how you can use them. By doing so, you are going to be a good first aider. So know all these things. I'm going to send you these notes. Then you search on YouTube, or it can be on Google, how are these things are being done, how the first aid do these things. By doing so, you're going to be a good first aider in the society or community. So let's proceed. Oh wow, so first aid in emergency. So we are going to end here for today's lesson. So as you can see, he is doing the cardiac arrest, CPR, the one I have been talking over and over. It's doing the palpation. So search what CPR is and how they do it. Yeah, before I send some tips, I'm going to send you though, but if you have enough bundle, you find time and do the research so that you have familiar of what I'm explaining, and we can be moving together by doing so. Sure. So first aid in emergency. So what is he doing here? This person is unconscious, definitely is having difficulties in breathing, so he's trying to regain the consciousness of this casualty laying down here. The way as I laid down is supine position, meaning is in the recovery position where the person can breathe properly, can receive enough air or oxygen rather, and again even the blood circulation can be moving normally in the body. Sure. So next time when we meet, we're going to talk about how these emergencies are being done, from what causes shock to occur. We'll talk about shock in life-threatening medical condition as a result of insufficient blood flow throughout the body. Shock often accompanies severe injury or illness. We're going to talk about this. Then we're going to talk about signs and symptoms. Oh yeah, that's good. Talk about signs and symptoms here. Yeah, and what is being done here. Talk about the management. From there, I'll talk about the definition. A burn is damage, blah blah blah. Then causes, prevention. Yeah, then until degrees of burns. Okay, we still have a long way to go, but don't worry, we'll finish. This is not something that we can worry of. We'll move faster as we can. So that was the today's lesson. We have ended from here. So we are going to meet next time. But please make sure, don't forget to subscribe on this channel and leave a like. Sure. Stay blessed. See you in the next lecture. Sure. Welcome once more at Supreme Institute of Applied Sciences and Technology. And those that didn't hear my introduction, this is Dr. Courage, D-R then K-H-A-L-L-E-G-Y. Others they ask, what's this Zambian name? Blah 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 blah. Never mind. You can call me whatever name that is easy for you. Yeah, otherwise, see you in the next lecture. Love you all and start well. Make sure you start so that you produce the good results, so that we can be proud of you. People that they come from Supreme, they don't lie. We make sure that we deliver the information that is needed. So see you.